Dr Sam here. A really common reason to go to the vet is to get your pet vaccinated. And a really common question is, what are we actually vaccinating dogs and cats for? So in this video, I'll be running through the most common vaccines that you will probably go to your vet for. So there's the core vaccines, which you've probably heard of as a C3. That's this guy over here. That contains parvovirus, distemper virus, and hepatitis virus, also known as a DHP sometimes. That's the most important vaccine that we give to pets because all three of those things are potentially life-threatening. Little Bo here is fully up to date, so he's protected against all of those things. Puppies have a schedule of requiring 3 shots of vaccines based on the brand of vaccines that we use here at Southern Cross Vet. The first one is given when they're normally about 6 weeks old. The first booster is given at 10 weeks, and then the final one, an early finishing booster, is given at 12 weeks when they're free to run around at the park with their buddies. So that's the core vaccine. Then what we call the non-core vaccines are kennel cough, which in combination with the C3 make up what's known as the C5, C for canine, 5 for the 5 antigens that are in the vaccine. And so in addition to the C3 that I just explained, it also contains 2 strains of kennel cough, Bordetella and parainfluenza. Kennel cough you can kind of think of like as whooping cough. In people, it's a very similar disease. That vaccine needs to be given annually, but the C3, once the puppies have had all of their booster shots, only needs to be given every 3 years based on the brand that we use here at Southern Cross Vet. Then the other non-core vaccine is leptospirosis or lepto. Some people call it lepro, but it's lepto definitely, leptospirosis. That one's normally recommended for dogs who live in the inner metropolitan regions where there's a lot of urban rats. It's transmitted by rats as it lives in rats' kidneys, and it can be excreted in the urine of rats. So if your dog is one of those dogs that spends a lot of time in the inner city area, sniffing around puddles, chasing rats, or loves to run around and splash in puddles at your local park, then the leptospirosis vaccine is definitely one that you should talk to your vet about considering boosting your pet with. So that's a really good overview of the main vaccines that Australian dogs need. There's also some individual vaccines that we have based on the individual patient that we customize. So for example, the kennel cough vaccine can also be given as an oral vaccine, which some dogs like Bo definitely prefer to have. So it's not given by injection or down the schnoz, it's actually given into their mouth. And then there's also intranasal options, which give much better immunity to the front of the schnoz where kennel cough starts. In addition to vaccinations, and arguably more important to not miss each year, is the annual heartworm injection. So heartworm is a parasite that is spread by mosquitoes. If you're living in an area that has mosquitoes, which is pretty much all of Australia, heartworm is a real risk for your pets. And in our opinion, the best way, safest way, most effective way to protect your pet against heartworm is with the annual SR12 injection. It's a simple injection given once a year, and it's close to 100% effective in preventing heartworm disease, which is a fatal disease. If your dog gets heartworm and it doesn't have any protection on board, it's rapidly fatal. There's a surgery you can do to help with removing the adult heartworms from the heart and the vascular system, but it's not very successful, carries a really high mortality and morbidity risk, and it's just much better to give the annual injection. The monthly heartworm tablets are effective if you give them bang on the same time each month. However, I want to warn everyone that there is increasing resistance to the common chemicals that are in these monthly ones. So that's just yet another reason to consider giving your pet the annual booster heartworm injection instead of the monthly tablets. A lot of these diagnostic tests that we need to do on your pet at the vet, they can sound pretty expensive, but thankfully, most insurance companies will pay up to 80-90% of the bill. So remember that pet insurance can really be the difference between your pet getting the care they need and maybe having to delay treatment. And the really nice thing about pet insurance in Australia nowadays is you've got a range of gap-only providers. So when you come to the clinic, you don't even need to pay the whole bill. They pay the clinic and you just have to pay what they don't pay.